Most people believe that if something is seriously wrong with their body, they will feel it immediately. They expect pain, discomfort, or some obvious warning sign that tells them it's time to take action. I used to think that was true early in my career as well. But after more than 25 years of caring for patients, I learned something that changed the way I view health forever. Some of the most dangerous conditions in medicine are not the ones that shout the loudest. They're the ones that stay silent. And perhaps no condition demonstrates this better than high blood pressure. Here's what nobody tells you. High blood pressure can quietly damage your heart, your brain, your kidneys, your eyes, and your blood vessels for years before you ever notice a symptom. No pain, no warning, no obvious clue that anything is wrong. That's why today's topic is so important. Understanding this silent condition could help you protect your health, your independence, and your quality of life for years to come. My name is Dr. Michael Anderson, and I'm an internal medicine physician. For more than 25 years, I've had the privilege of caring for thousands of patients. Throughout those years, I've seen many health conditions, but few have concerned me as much as uncontrolled high blood pressure. Not because it's rare. Quite the opposite, it's incredibly common. And that's exactly what makes it so dangerous. I've met patients who exercised regularly, felt energetic, and considered themselves healthy, only to discover that their blood pressure had been elevated for years. Some were fortunate enough to find out during a routine checkup. Others learned only after experiencing a serious health event. What I've learned is simple. Knowledge gives us power. And today, I want to share some of that knowledge with you. Before we discuss how high blood pressure affects the body, let's talk about what blood pressure actually is. Imagine your body's blood vessels as an enormous network of roads and highways. Your heart acts as the central engine, pumping blood through these pathways to deliver oxygen and nutrients to every organ and tissue. Blood pressure is simply the force of that blood pushing against the walls of your arteries. A certain amount of pressure is necessary. Without it, blood couldn't reach the places it needs to go. But when that pressure stays too high for too long, problems begin to develop. Think of a garden hose with water flowing through it. If you increase the pressure beyond what the hose was designed to handle, the walls experience extra stress. At first, nothing seems wrong, but over time, that stress causes wear and tear. The same thing happens inside your body. Let's start with the organ most people associate with blood pressure, the heart. Many people assume that if their heart is under stress, they will feel chest pain or experience obvious symptoms. Sometimes that's true, but often it isn't. The heart is remarkably resilient. It can compensate for increased workload for years. That's the good news. The hidden risk is that every heartbeat becomes a little more difficult when blood pressure remains elevated. The heart must push harder against increased resistance. Over time, the heart muscle may become thicker, much like any muscle that is forced to work harder. Initially, that may sound beneficial, but eventually, the heart can become less efficient. I remember a patient in his late 60s who felt perfectly healthy. He walked daily, played golf, and rarely missed an opportunity to stay active. During a routine examination, we discovered significantly elevated blood pressure. He was shocked. "Doctor, I feel fine," he told me, and he did. Yet his heart had been working overtime for years without his knowledge. Thankfully, we identified the issue before serious complications developed. Have you ever wondered what your heart might be dealing with, even when you feel completely normal? But the heart is only part of the story. The next organ affected by high blood pressure may surprise you: the brain. Here's where things become particularly important. Many people associate strokes with sudden symptoms: a drooping face, difficulty speaking, sudden weakness. And while those symptoms can occur, the process often begins years earlier. High blood pressure gradually damages the delicate blood vessels that supply the brain. The positive side is that the brain is incredibly adaptable and capable of remarkable recovery under the right circumstances. However, the hidden danger is that damaged blood vessels may increase the risk of stroke and may even contribute to changes in memory and thinking over time. I once cared for a retired teacher who noticed subtle changes in concentration. Nothing dramatic. She simply felt that her memory wasn't as sharp as it used to be. Further evaluation revealed years of uncontrolled hypertension. What surprised her most was learning that blood pressure affects much more than the heart. Were you aware that managing blood pressure may also help protect brain health? Now let's talk about the kidneys. Most people rarely think about their kidneys, and honestly, that's understandable. They work quietly in the background every day. They filter waste, balance fluids, and help regulate essential functions throughout the body. The good news is that the kidneys are remarkably hard-working organs, but they also depend on thousands of tiny blood vessels to function properly. When blood pressure remains elevated, those delicate vessels can become damaged. The kidneys may slowly lose their ability to filter blood efficiently. The surprising part is that early kidney damage often produces no symptoms at all, no pain, no discomfort, no warning. I remember a patient who came in for routine blood work and felt completely healthy. His laboratory results told a different story. Further testing revealed kidney damage linked to years of elevated blood pressure. Fortunately, we were able to intervene before the condition became severe. Have you ever considered how many health problems can develop silently before symptoms appear? Another area people often overlook is vision. Most of us think of eye exams as something we do to update our glasses prescription. But eye doctors can sometimes see evidence of high blood pressure before other symptoms appear. That's because the eyes contain tiny blood vessels that reflect what's happening throughout the body. The positive news is that regular eye examinations can help identify problems early. The hidden risk is that uncontrolled blood pressure may gradually damage these vessels, potentially affecting vision over time. I recall a patient who scheduled an eye exam because she noticed slight changes in her reading vision. During the examination, signs of blood vessel damage prompted additional medical evaluation. The result was a diagnosis of high blood pressure that had gone unnoticed for years. A routine eye appointment may have prevented far more serious complications. Did you know your eyes can reveal important clues about your overall health? One of the biggest mistakes I see involves assuming that feeling healthy means everything is healthy. This misunderstanding is incredibly common. After all, if you don't feel sick, why would you think something is wrong? The reality is that high blood pressure often remains completely silent until significant damage has already occurred. I've had countless patients tell me, "Doctor, I feel great," and many of them genuinely did. That's what makes hypertension so deceptive. It often progresses quietly in the background while life continues as normal. Small damage, day after day, year after year. Have you ever delayed a health check because you felt fine? Fortunately, there is good news. High blood pressure is one of the most manageable health conditions we know about. Many people assume they need to make dramatic lifestyle changes overnight. But in my experience, meaningful improvement often starts with small, sustainable habits. I've seen patients lower their blood pressure through regular walking, healthier food choices, better sleep habits, stress management, and, when appropriate, medication prescribed by their physician. One patient started by taking a 10-minute walk after dinner every evening. That's all. No complicated fitness program, no extreme diet. 6 months later, his blood pressure had improved significantly, and he felt more energetic than he had in years. Small habit, big impact. What healthy change could you begin today? Before we finish, I'd like to share one story that perfectly illustrates today's message. Several years ago, a woman in her early 70s visited my office because she occasionally felt tired. Nothing severe, nothing alarming, just a feeling that something wasn't quite right. During our conversation, I learned she hadn't checked her blood pressure in several years. Her readings were consistently elevated. Together, we developed a realistic plan. She began walking regularly. She improved her eating habits. She monitored her blood pressure at home. And when necessary, we used medication as part of a broader strategy. Over the following year, her blood pressure improved substantially. More importantly, she gained confidence and control over her health. Years later, she still tells me that learning about her blood pressure changed her life. Not because she became perfect, but because she became aware. And awareness led to action. If there is one lesson I hope you remember from today's discussion, it is this. Silent conditions require visible attention. High blood pressure may not cause pain. It may not interrupt your daily routine. It may not make you feel sick. But paying attention to it today can help protect your heart, your brain, your kidneys, your vision, and your future quality of life. Awareness creates opportunity, and opportunity creates better outcomes. Today we've discussed how high blood pressure can quietly affect multiple organs throughout the body, often without causing noticeable symptoms. We've explored why routine monitoring matters, why feeling healthy doesn't always mean everything is healthy beneath the surface, and why small daily choices can have a powerful impact over time. I'd love to hear from you. When was the last time you checked your blood pressure? Did anything in today's discussion surprise you? Share your thoughts in the comments below. Your experience may help someone else become more aware of their own health. And if you found this information valuable, consider sharing it with a friend or family member who may benefit from hearing it. Thank you for spending this time with me. Stay informed, stay proactive, and remember that some of the most important health decisions are made long before symptoms ever appear.